One of the most successful surgeries, if you look at in last 30 years in the world, has been knee replacements. And there has been an enigma, which knee prosthesis or implant to put in a patient, and this goes with an obvious choice. Why not to give your patients the best? The best is always a relative word. But now here comes two things. Number one, quality. And number two, transforming it into a good quality of life for the patient. So why not to trust the best companies in the world, right? When I started my practice, I was doing a particular company, right, which is the oldest company in the world, and I started using their same implants. And I was gifted enough that that company subsequently launched a robot today. And the advantage is that robot is compatible with the implant I'm using. So I became a natural surgeon with the robot as well. Because today my patients walk to me and they want to ask me what is latest, what is the safest, and what's the best. Now everything is got a relative connotation to it. But this is what I want to tell you. There has been study for years altogether, and they say that if you have an implant which closely tunes to the human body, it will give you two things, a natural feel and a good movement. If you have an implant which is tested for long number of years and made of a composition of cobalt, chromium and molybdenum, you do expect that this is going to be a better one. And then there has been, when there's a metal on the thigh, metal on the leg, then there has to be something in the between which is going to provide you movement. And there, when you provide a movement, that cannot be metallic, because metal to metal erosion is going to be very high. That has been proven. So what they want to put is, they want to put a highly cross-linked pollen, which is called as polyethylene. This highly cross-linked polyethylene, again a research on that, and there has been a name called as Cavonox for that, which is a very, very trusted metal in the world now. When you look at something which gives you good size options, right, it's like a customized implant, it's always better to have it. That converts into a better range of movement, a natural feel, better precision for the surgeon, because every millimeter transforms into the years of longevity. Normal implants, they claim up to 20 years of life, and if you have something which is better, as I'm telling to conforming to the tune of the human body, it claims up to 24 years, the longest ever claimed in this earth. Alright, you have to understand, when we added robot to the surgeries, it gave you few things: more precision, lesser bone loss, lesser blood loss, maybe a questionable decrease in the size of the incision, but yes, converting into less pain, a quicker recovery, bone conservation, and most importantly, if you're taking an implant today, start thinking that you are going to become a robotic surgeon one day. So your implant has to be robot compatible. It's not like Airtel or Vodafone that you have a portal, you can shift it from one to other. Implants go with the robots and they stay with the robots. Remember, the supreme thing in the world is patient satisfaction. And today, the world is ready to accept a robotic replacement. Now, when I talk about a particular implant, it is very, very important that there is US FDA approval, because till the time you don't have this US FDA approved, you cannot use it in the human body. It's for the drugs, it's for the prosthesis, for the implants. This is a common body governing throughout the world, throughout the globe. You have to understand, as explained, the composition has to be supreme. The things are easier to be used by the surgeon, because finally it's a surgical skill complemented by the robot. It's not the other way around. You have to have more conformity to the natural joint, and the material should be so much that it has a longer duration of lasting. And then only you can be having a normal functional knee, which is going to change the life of a patient, because patients walk to you for a knee replacement because the knee is the offending agent limiting the activities of daily living. Finally, the technology in the implant progression, the technology in the robotic replacements wants to improve the function to lead the patient to a pain-free life. Why not to offer your patients the best? Why not to offer your patients the safest? Why not to offer your patient which is natural? Why not to offer the patient which is the latest? When there's a robot to assist you, when it's there to navigate you, it's very important. We do remember, right? Asking each other, भैया उस दुकान तक जाना है, कैसे जाएं? And it was always like, सीधा जाके राइट लेके लेफ्ट हो जाइएगा. Why not to use a Google map today? When you know that take a right after 100 meters, take a left after 20 meters, another U-turn after 10 meters, and your destination is on the left. And that's what the technology does to you. Welcome to the world of the next generation. Thank you very much.